So good afternoon. I just want to first say thank you for reading my post about my son Ben. I posted about 3 weeks ago on LinkedIn, and it got so far about 45,000 views and 164 comments. I'd like to thank all of you who had commented on the story, and most importantly, I'd like to thank everyone who knew Ben and took the time to share some of their stories. If I have any consolation over Ben's death, it would be that I had the ability to share that part of his life, even though it was not very long, with my family from that hospital. So I had just walked in. This is the hybrid OR. I'll give you a quick little pan. This is the hybrid suite at the local hospital that I'm the director of this program. My hat's crooked. And I just walked in here to do this quick little video. What you see right over my shoulder is an anesthesia machine. Sadly, very sadly, I'm disappointed. I'm going to back up and show you something I just found. I didn't place it here. I don't have access to this, but you see that little can sitting here? This is a can of Sevoflurane, and this is the gas that had killed my son. And here it is, sitting right in the open where anybody can grab it. And it does have a little bit of fluid in it. It's probably not enough actually to kill you with. Saying that, I wouldn't want to try it. So that's going to be a phone call. I just wanted to share with you a little bit of my thoughts today as I was driving to work across the beautiful Sunshine Skyway here in Florida, and had a few moments to think about what I would say. And I brought a few pieces of paper with me, not knowing what I would say today, but I did want to make a video. And the first is my son's birth certificate, which is always the happiest day of a man's life, is the day his son is born. And I have a packet I thought I'd share with you. I'm going to cover one of the last tangible items I have of my son, which was his work badge. And a copy of his death certificate. So that's a copy of his death certificate from Harris County, which is Houston, Texas. You get a death certificate about 2 to 3 weeks after somebody dies. You can order the number of copies you need. After I found Ben dead, it was a crime scene, obviously. There was that can of Sevoflurane sitting about 3 feet behind him when I found him. After he was picked up by the coroner, I was told I'd get a coroner's report. So he died somewhere after 1 a.m. on New Year's Day. I found him about 4:30 a.m. I estimate he was dead for at least 16 hours. So that's an autopsy report. I got his autopsy report on my father's birthday, which is St. Patrick's Day. So you take that, it's 3 months and 13 days after my son died until I got an autopsy. So I'm going to read to you an autopsy report because of that little yellow can right there, left unsecured. State of Texas, Harris County. I, Louis A. Salazar, ND, Executive Director and Chief Medical Examiner of Harris County, do hereby certify that the attached autopsy report and toxicology report, where applicable, represent a true and correct copy of the autopsy, external examination, and findings of the body of Benjamin Douglas Clemson, case ML 16-0013, witnessed by my hand in Harris County, Texas, this 17th day of March, 2016. Subscribed and sworn to me before this day, 17th of March, 2016. Autopsy report. January 2nd, 2016, on the body of Benjamin Douglas Clemson. Cause of death, acute sevoflurane intoxication. Manner of death, accident. Date of death, January 1st, 2016. Post-mortem examination. I'm going to try not to cry. This is going to be the first time I've read this since the 17th of March. So, Benjamin Douglas Clemson. History. The descendant is a positively identified 24-year-old white man whose death was pronounced on January 1st, 2016 at 5:10 p.m. at 12025 Richmond Avenue, number 7103, Houston, Texas. Autopsy. The autopsy is performed at the Harris County Institute of Forensic Science by Assistant Medical Examiner Darshan R. Pathak, MD, pursuant to Article 49.25 Texas Code of Criminal Procedure at beginning of 12:45 p.m. on January 2nd, 2016. Photographs and fingerprints are taken. External appearance. When first viewed, the descendant is clad in a blue jacket and black shirt, striped gray shorts, green boxer shorts, and 2 black socks. The body is accompanied by a properly labeled plastic bag containing a blue towel that is retained. No personal effects or jewelry are present. The body is that of a well-developed, thin adult male whose appearance is compatible with the aforementioned stated age. The 145-pound body is 74 inches long. The cold, unembalmed body is in a state of very early decomposition and has partial rigor and fixed anterior lividity with cutaneous petechiae of the eyelids, face, neck, and chest. And they're called Tardieu's spots. Evidence of decomposition include green abdominal skin discoloration. The remainder of the external examination will be in regards to the findings not associated with decomposition. The curly, sandy blonde to brown scalp hair extends to the upper back. No beard or mustache is present. The body hair follicle distribution is that of an adult male. The eyes have white sclera, clear corneas, white irides, and have diffuse scleral hemorrhages and palbrachial conjunctive petechiae. The ears, nose, and lips have no injury. The nasal septum and oropharyngeal frenula are intact. The teeth are natural. No injuries of the tongue, gingiva, or buccal mucosa are present. The neck has no injuries. The stomach, the chest is asymmetrical. The abdomen is soft and concave. The extremities are well developed and symmetrical. The external genitalia, anus, and perineum have no injuries. The penis appears circumcised and the testes are descended into the scrotum. The back and the extremities will be discussed further under evidence of injury. Identifying marks and scars, none. Evidence of therapy, none. Evidence of injury. The lumbar sacral back has two irregular circumscribed abrasions measuring 1/2 inch and 1 inch. The tip of the right shoulder has a 1/4 inch abrasion. The lateral right side of the chest has a 3/8 inch abrasion. Internal examination. Evidence of decomposition includes duskiness, darkening, and discoloration of the viscera, serosal, mucosa, and endothelial intimal surfaces, and black to brown discolorization of the myocardium and marked softening of the skeletal musculature. The remainder of the internal examination will be in regards to the findings not associated with decomposition. Body cavities. The thoracic and abdominal organs are in the usual anatomic position. The body cavities contain neither adhesions nor abnormal fluid collections. Head and central nervous system. The scalp and subgluteal soft tissues have no hemorrhages. No skull fractures are present. No epidural, subdural, or subarachnoid hemorrhages or membranes are present. The leptomeninges of the 1,425 gram brain are thin and translucent. The symmetrical cerebral hemispheres have expanded gray and attenuated sulci. No contusions, hemorrhages, masses, atrophic changes, cavitations, or herniations of the cerebellum, cerebrum, or brainstem are present. No hemorrhages of the basal ganglia or deep white matter are present. The cerebral ventricles do not contain blood. The cranial nerves and cerebral vasculature are unremarkable. No atherosclerotic plaques or aneurysms are present. Neck. Periovertebral fascia, cervical strap muscles, and scalene muscles have no hemorrhages. The hyoid bone and laryngeal cartilages are intact and have no fractures. Cardiovascular system. The aorta and its branches, the great veins, are normally distributed. The intimal surface of the aorta is diffusely involved by faint yellow streaks. No fissures, calcifications, or aneurysms are present. The pericardium, epicardium, and endocardium of the 325 gram heart are smooth and glistening. The right dominant coronary artery system has neither osteal abnormalities nor atherosclerotic plaque. The foramen ovale is closed. No thrombi in the atria or ventricles. The atrial and ventricular septum are intact. The thin and translucent tricuspid, pulmonic, mitral, and aortic valves are devoid of redundancies or vegetations, having respective circumference of 10.0, 8.5, 9.0, and 7.0 centimeters. The left and right ventricles have respective maximum wall thickness of 1 and 0.4 centimeters. The interventricular septum has an average width of 1 centimeter. No myocardial scarring or hemorrhages are present. The ventricles are not dilated. Respiratory system. The epiglottis is thin. The upper respiratory tract is unobstructed. No mucosal hemorrhage of the larynx or trachea are present. The major bronchi contain white foam. The 725 gram right lung and 700 gram left lung each have edematous purple parenchyma without masses, hemorrhages, or consolidations. The pleural surfaces are marred by anthoracic streaks and have no emphysemic blepping. The pulmonary arteries contain neither thromboemboli nor atherosclerotic streaks. Gastrointestinal system. The esophageal mucosa is gray, white, and smooth. No erythema or varices of the gastroesophageal junction are present. The stomach contains 50 milliliters of tan and pink fluid without any intact tablets, capsules, or granules. No gastric or duodenal mucosa ulcers are present. The small and large intestines are externally unremarkable, and the appendix is intact. The lobulated pink pancreas has no masses, cysts, or hemorrhages. The hepatobiliary system. The 1,400-gram liver has sharp contours and is covered by a smooth, glistening, intact capsule. The congested brown hepatic parenchyma has no masses, cysts, or hemorrhages. The gallbladder contains 10 milliliters of viscous brown bile and no calculi. The extrahepatic biliary ducts are not obstructed. Reticuloendothelial system. The atheric pink-yellow thymus is grossly infiltrated by adipose tissue. The 225-gram spleen is covered by an intact purple capsule that has friable parenchyma with inconspicuous white pulp. No lymphadenopathy is present. Endocrine system. The pituitary gland, thyroid gland, and adrenal glands have no masses, cysts, or hemorrhages. The parathyroid glands are inconspicuous. Genitourinary system. The 175-gram kidney and 150-gram left kidney each have smooth and slightly lobulated subscapular surfaces. The cornices are of average thickness and have distinct chordomedullary junctions. The calcised pelvis and uterus have no masses, cysts, or hemorrhages. The bladder contains 20 milliliters of pink to yellow urine and has smooth gray-white mucosa. The prostate gland and testes have no masses, cysts, or hemorrhages. Musculoskeletal system. No fractures of the sternum, clavicles, pelvis, ribs, or vertebra column are present. The diaphragm is intact. Toxicology. Aliquots of blood, vitreous, urine, bile, stomach content, liver, brain, and volatile containers with ambient air, and additional brain are submitted for analysis along with the aforementioned blue rag. The plastic bag that accompanies the descent contains a folded blue towel that is retained. Histology. Sections of the heart, lungs, liver, kidneys, spleen, brain, and pancreas are submitted for processing under glass slides. See separate report. Pathological findings. Acute sevoflurane toxicity. A. Sevoflurane in blood, adipose tissue, and right lung. See toxicology. Sevoflurane bottle and aerosol container in vicinity of descent. Cerebral edema, brain, 1,425 grams. Pulmonary edema, lung, 1,425 grams. Fixed anterior lividity, cutaneous tardieu spots, and conjunctival petechiae. Descendant found prone and crouched, with blue rag in possession. Dilated cardiac right ventricle, heart 325 grams. 3. Mild aortic atherosclerotic. 4. No evidence of pathophysiological significant trauma. 5. Very early decomposition. Harris County Institute for Forensic Science. 1885 Old Spanish Trail, Houston, Texas, 77054-2001. Microscopic examination. The brain has rare-filled neutrophil with inflammation, gliosis, or hypoxic ischemic neural changes. The heart has minimal cardiomyotic hypertrophy and slightly increased intramyocardial, perivascular, and subendocardial fibrosis. No inflammation is present. The lungs are congested and have interstitial atherosclerotic deposits and carbon-laden macrophages. No vasculature hyperplasia, ectatic alveoli, peribronchial smooth muscle hyperplasia, inflammation, or polarizable foreign material is present. The liver has diffuse sinusoidal congestion and minimal microvasculature stenosis without lobular neurophilia. Hepatocellular necrosis, abnormal portal fibrosis, inflammation, or bile ductal abnormalities. The pancreas is autolyzed. The kidneys have no sclerotic, glomeruli, vascular abnormalities, interstitial fibrosis, inflammation, tubular necrosis, or polarizable foreign material. So this shows an anterior and posterior review of what any markings that were found on my son. Laboratory test report. Deceased Benjamin Douglas Clemson. Specimen brain. Analyte, sevoflurane, present, headspace. Specimen, fat. Analyte, sevoflurane, present, headspace. Specimen, lung, analyte, sevoflurane, present, headspace. That's the method. Specimen, bile, analyte, ethanol, methanol, isopropyl, acetone. Result, none detected. Specimen, blood, heart, analyte, ethanol, methanol, isopropyl, isopropanol, acetone, none detected. Specimen, brain, analyte, other volatiles, result, none detected. Specimen, fat, analyte, other volatiles, none detected. Specimen, lung, analyte, volatiles, none detected. Specimen, vitreous humor, analyte, ethanol, methanol, isopropanol, acetone, none detected. So, the beginning of a very dangerous and heartbreaking path can be just from simple experimentation that may seem harmless to us in the medical field. It's readily available. It's sitting out. Literally sitting out. What makes somebody grab it? What makes somebody try it? What makes someone think they're invincible? I don't know. But I'm left with the aftermath of my son's experimentation that was partially contributed to or made easier when we find unsecured narcotics, analgesics, paralytics, barbiturate gases in the yellow can. So, for those of you who had read the story, for those of you who have seen it because it was shared, for those of you who are in anesthesia school or in the medical field, I would very much caution you to ever think that you could try a narcotic or an analgesic or a sedative or whatever you want to call it and think that there's no possibility. There's just no way that death's going to find you. Because you're sadly mistaken, and it's the ones left behind that are going to have to sweep up after you. Don't do it.